Hi, everyone. My name is Ying Lo. I'm a student in HIM program. Today, my presentation is introduce healthcare data sets, OASIS, HEDIS, DEEDS, and UHDDS. As we know, in every healthcare setting, there is data that is collected and stored to be used for a lot of reasons, such as patient care, reimbursement, and research. Just to name a few, from the collected data, datasets are collected. Datasets are used in all types of healthcare settings and are used to identify the data elements that are collected on each patient and to also define common terms used in that datasets. The datasets I will discuss today are OASIS, HEDIS, DEEDS, and UHDDS. In this presentation, we will know what is healthcare datasets, purpose of healthcare dataset, introduction of OASIS, HEDIS, DEEDS, and UHDDS. Also, we will know benefits of healthcare datasets. So what is healthcare datasets? A list of recommendation data elements with information definitions. A dataset is a standard method for collecting and reporting individual data elements. Each healthcare facility develops a data dictionary, which is a collection of data elements definitions. The dataset, usually for collection and reporting purpose, depends on patient type and includes a lot. Today, we just discuss 4 of them. First, we should know the purpose of healthcare datasets. To identify the data elements that should be collected for each patient, also to provide uniform definitions for common terms. The first one we discuss is OASIS, Outcomes and Assessment Information Set, a standard data set designed to gather data about Medicare beneficiaries who are receiving service from a home health agency. It includes a set of core data items that are collected on all adult home health patients. It's sponsored by the Healthcare Financing Administration. This dataset includes a set of data items collected on adult home health patients. Data are used to assess the outcome and measure the quality of the healthcare service given to the patient. The second one we discuss is HEDIS, the Health Plan Employer Data and Information Set, a set of standard performance measures designed to provide healthcare purchasers and consumers with information we need to compare the performance of managed healthcare plans. Administrative, claims, and health record review data are collected. It's sponsored by the National Committee for Quality Assurance, a standard performance measure designed to provide purchasers and consumers of healthcare to compare managed healthcare plans. The information collected about specific health-related conditions is used to analyze and assess outcomes of treatment. One of the goals of HEDIS is to encourage the performance improvement for health plans and practices. This is why HEDIS developed the physician's profile, like diabetes care, smoking cessation programs or breast cancer screen back. The third one we discuss is DEEDS, Data Elements for Emergency Department Systems, a dataset used to support the uniform collection of data and hospital-based emergency departments, and to reduce incompatibilities in emergency department records. It was developed by the Centers for Disease Control and Prevention and the National Center for Injury Prevention and Control. DEDS recommends the collection of 156 hospital discharge data sets. The last one we discussed today is UHDDS, Uniform Hospital Discharge Dataset. It lists and defines a set of common uniform data elements for every hospital inpatient, includes principal diagnosis, principal procedure, and other significant procedures. It was developed in 1969, Conference NCHS, National Center for Health Service and Research and Development, in Johns Hopkins University. All short-term general hospitals in US must connect minimum set of patient data elements, UHDDS. After we know these 4 data sets, we should know benefit of health data sets. I'm trying to be simple. 1 is improve communication between healthcare professionals. 2 is improved patient outcomes. The third is early interventions due to early detection of signs and symptoms. After this presentation, we want to know, as the healthcare system continues to grow and more complex, the healthcare item system demands comprehensive solutions to promote data standardization. Health data provide compassions for clinic studies, can be used to assess costs of healthcare, can help identify needed prevention targets for such programs, and are important for program planning and evaluation by finding a baseline against which to measure in the evaluation phase. Okay, this is my presentation today. Hope this simple introduction can let you know some information about healthcare datasets. I did some research online. There are lots of details and information. If you're interested more, you can search online and get more information. Thank you very much. Have a good weekend.